to everyone that provided insights this morning. Very helpful to hear your comments. And so we have a few questions that have come in from our chat. And so I wanted to start with Dr. Brandstetter. Dr. Brandstetter, we've had a few questions. This is a two-part question for you. You spoke about a family who came in and were later diagnosed with COVID. They didn't come in initially for COVID. Was that family hypothetical or real? So that's one. And then secondly, we're hearing from some readers who hear that Omicron is mild and that indeed people are getting infected, but they believe that if people get severely ill and die, it's not a result of COVID, but it's a result of another condition. Can you speak to that as well? So first is about the family you spoke about, and the second is the conditions for the severe illness and death.
Thank you for very important clarifications in the questions. Unfortunately, and dishearteningly, that is a very, very real situation that was faced by a family. So that is a unfortunate, tragic event that, again, what if could have been prevented. That's the very saddening, and I can't say how every day we face very similar situations of this could have been different. And the vaccinations, while may not prevent infection and even symptoms from COVID, can prevent the deaths and the severe illnesses. And the humbling thing about COVID-19 is we are not able to predict who will have these severe complications. Long haul COVID, a comorbidity that is devastating and life-changing, such as an overwhelming stroke. So to answer the second part of the question, is the mortality from COVID-19 or some other incidents, particularly those who are subsequently diagnosed with COVID after presenting from another illness? So COVID-19, most of the time when they're admitted for COVID-19, is the cause of death. When someone is admitted for another etiology and subsequent diagnosed with COVID-19, COVID-19 often contributes to the morbidity and mortality. It may not be the primary responsible etiology for their death, but it is certainly contributing. Let me give you a few examples. A young gentleman in his 20s presented with an acute heart attack, died from his heart attack in his early 20s with no risk factors. Turns out that he was COVID positive. His increased clots and devastation from those was caused by his COVID-19 infection. So he did not die of COVID pneumonia or the infection. He died from the heart attack that was a result of the thrombosis caused by his COVID-19 infection. So yes, people are dying from COVID-19. They're diagnosed with other etiologies and present with those, such as strokes, heart attacks, blood clots to the lungs, renal failure, worsening heart failure, all worsened by COVID-19. And the severity of those illnesses can be significantly reduced by vaccination and prevention. Thank you.
Thank you very much. So Dr. Morgan, I'm going to come to you next, and then Dr. Jansen after Dr. Morgan. Dr. Morgan, are people trying to intentionally contract COVID, as you mentioned?
Thanks for that question, Katie. And that is a big concern. And I have gotten that question so many times until it is a concern. And I think certainly there is a cadre out there within the United States that certainly is tired and exhausted and thinking that maybe this is the way to get to the end, because people can't really see their way out of that. And so hopefully that is not happening, but I have to say that in some cases it probably is, because I have gotten that question so many times that is a reflection then of what some in society are also thinking. And so I want to reiterate, certainly at this time, but this particular variant, that is a terrible idea. We have staffing issues. We have therapeutic shortages. We are triaging care. This is not the time to take a risk like that with your life. You might be lucky, but you might not be. This is not a virus that has killed no one. So we want to be clear about that. This is not a strategy that we are supporting as a scientific community for you to move forward with intentional infection.
Thank you, Dr. Morgan. Dr. Jansen of Grady. some of the state data suggests that Georgia, or maybe at least Metro Atlanta, has peaked. Do you believe this is so? And what does your health system foresee in the weeks ahead?
So I'm hearing from some of my colleagues, they're beginning to see some decrease in the number of cases in the hospital. Like I said, at Grady, we've not quite seen that. We did see a slight dip in the number of admissions. The thing to remember about this, though, is we now have so many patients who are hospitalized across all hospitals that even as the peak subsides, the number of cases already hospitalized is much larger than what we've seen in the past. So, you know, we've seen in other countries that the cases start going down. I am hopeful that that's what we're going to start seeing both at Grady and across the city. But, you know, COVID is also sort of a local infection. I know we talk about state statistics and US statistics, but it's a local community phenomena. And you may have outbreaks that are in certain communities that impact that local health system that you're not seeing in other parts of the city. So some of that phenomena, I think, is the reason we're still seeing as many patients as we are, and others may be seeing a decrease. You know, if you look at what's going on across the state and across the US, it seems to not only start in a wave, but it is a wave that goes from community to community, from urban to rural, from state to state. And so it can be a little deceiving when you look at large statistics across large populations to know what's going on in your community.
Thank you, Dr. Jansen. And I am actually going to go to Dr. Shane of Children's Healthcare. And you certainly highlighted in your comments about the impact on children with the Omicron virus, but you also have a good eye on the whole state, given that you are our children's resource, healthcare resource for the state. And I'd be curious, do you have any concerns for the health systems that are in more rural parts of Georgia, given what you've seen from this variant? We do have significant healthcare capacity in the region, but I'm curious from a statewide perspective if you have any thoughts. That's for Dr. Shane.
Thanks, Katie, and a fabulous question. Yes, we have tremendous concerns about rural access to care. We're very fortunate to be located in Atlanta, but once again, we have many pediatricians in the community who are really struggling with children who are COVID infected, whether or not those children are going to progress to needing higher levels of care that cannot be provided in regional hospitals. It's a tremendous concern. And also just having familiarity with taking care of children. Several people have discussed the challenges of post-infectious complications. And it can be very challenging if you're caring for a child who may or may not have underlying medical conditions, who you're concerned may progress, and you may not have the capability in your local facility to take care of that child. So I would say that rural access to care is a tremendous concern in both the pediatric and the adult population.
Thank you. Sharon with Emory, I'm going to come to you next. You mentioned about ICU nurses not being able to give maybe the highest care a patient needs, or may have to prioritize the care that is given. Can you maybe describe what that looks like specifically, and what is the effect you have seen on the nurses?
Sure. You know, the way that we're wired as nurses is that we don't want to leave anything out. You know, we believe everything is important, and I think that's wonderful. But I will tell you that we have been able to sit down with the nursing staff and actually talk through with them what we hear are things that might be things that we could put on the back burner, like documentation requirements. You know, we like to be comprehensive with that, but what are the very essential things that other people need to know about this patient that are essential for our documentation? And we're prioritizing those things so that we do have good communication across clinicians, as well as from one day to the next. So documentation requirements is one area that might look like. We also have been able to augment some of the nurse staffing with other levels of technicians, and even to the point of other levels of individuals who are just willing to volunteer, such as nursing students. You know, we've been able to bring those folks in to augment the nurse who might have an additional patient today that under normal circumstances she would not have that number of patients. And so we're just really trying to prioritize the must-have patient safety, quality care things that are must-haves, and making sure that we keep the nurses supported as best we can with other different types of clinicians and partners as they provide care to patients.
Thank you, Sharon. And we have time for one more question, and I am going to go to Dr. Manapelli of Northeast Georgia. And really the purpose of being here today is again to encourage the public to follow the recommendations of our healthcare providers. And so I'd like to ask you, do hospitals feel that outreach efforts and public announcements and pleas like this that we've heard today are being heard by the public? And is there anything that those listening today could do to help amplify the messaging?
So yes, and they are being heard, but we have to continue to reinforce them. That's the most important thing. After 2 years of being in this pandemic, everyone is just tired of hearing the word COVID, but we're still here in the middle of our 5th wave, and we just have to continue to reinforce. In our community here, with our Hall In campaign, where we involve our community members, leaders, we continue to reinforce the importance of getting vaccinated, staying up to date with the vaccine, and also, again, the 3 W's about wearing the mask, washing hands, and watching your distance, avoiding crowds, all of this. So this is an ongoing effort that we continue to use our social media pages and through our Hall In campaign. And we have to, as leaders, as healthcare leaders, we have to continue to reinforce that message that we're still in it.
Well, thank you to everyone who submitted questions, and especially to our experts who were here to provide commentary and answer questions. I know there were a number of questions that came in that we were not able to get to. If you are a member of the media, please direct any remaining questions following the program to the PR teams for each of the health systems represented here today. And again, we appreciate these healthcare heroes and leaders for being with us today, as well as everyone that participated in today's event, who are going to amplify the messages that we heard. So we're grateful for the collaboration and dedication to the health and wellness of our citizens. And to recap, COVID-19 is not over. We are still in a pandemic that is impacting our communities and health systems. We hope this press conference has helped you to further understand how COVID-19 continues to affect our city, our state, and our communities. Thank you, and wishing all of you a healthy day.